Hello, my name is Julie Pollard and I'm the Social Prescribing Coordinator for the voluntary sector in Cornwall. With my colleagues today, we thought it would be helpful for new social prescribing link workers to use this sort of training module to have some support for their new and developing roles. It will give them the opportunity to look at session structure and how to work with patients.
Morning, Simon. Thanks for coming in. It's good of you to take a bit of time out to meet me.
No problem.
So I'm Jackie.
Hi.
And I think, if I remember correctly, Dr. White suggested we have a chat.
That's right, yeah.
After your last appointment with him. Okay, that's lovely. So, did he describe to you what my role is, what a social prescribing link worker does?
In a sort of sense, just said that I was to come and see you to have a chat about some of the things that are going on for me at the moment.
Yeah,
really.
And that is what it's about, definitely. Social prescribing link workers are not clinically trained. We are in the role of helping to link you up with services, organisations, information, whatever is going to be useful to you, really. We're in the really privileged position of having quite a lot of time today. We've got up to an hour to have a chat. So it's very different from the clinical appointments where you'd have 10 minutes with someone and you're asked, right, what's wrong? Today we're all about finding out what's important to you, the changes that you'd like to make. It's about your life, really, which is why we've got more time.
Okay.
So we've got up to an hour today. If it's okay with you, I'm going to take a few notes as I go, because otherwise I might well forget what we talk about and I don't want to miss anything.
Sure.
So we'll meet today. The plan is always for us to have an appointment again in 6 weeks' time so that we can check in with you.
Okay.
But I might well give you a call in between, or I might be emailing you some information if that's how you like to receive information. It's always possible, if you wanted to catch up with me about something in between from now to that 6 weeks, you can always call the surgery and ask for that sort of interim appointment if you wanted to.
Okay.
But do make that appointment through the surgery, and we'll make your 6 weeks appointment before you leave today.
Okay.
And then we have a formal check-in again in 3 months' time from today, and then again in 6 months.
Okay.
So it's quite a nice period of time that we've got, and things might change for you and we can discuss things as they go.
Okay.
So does that all make sense, first of all, to you?
Yeah.
Does it give you an idea of what we can start to look at together?
So yeah, so how long were with you in total?
6 months.
6 months.
Yeah.
Okay, great.
Yeah. And you know, even if it needed to be a little bit longer,
Okay.
we can be a little bit flexible.
Okay.
So always at the beginning of these appointments, I'm just talking at you for a few minutes, so forgive me for that, but we just need to make a few agreements and I need to let you know about how all of this works, really. Everything we talk about is confidential today, but just to say, I will put notes on the doctor's system, and I've got access to what your notes have been, your consultations have been, say with Dr. White. And we also use a database which is very secure, something called Elemental, and we just record how things are going for you, so what your initial appointment is about, what we discuss the next time.
Okay.
And it's important that we use that, so I need your permission to be able to do that, if that's okay.
Yeah, that's fine. Yeah.
So that is outside of the NHS.
Okay.
And it's used to evaluate, to see how social prescribing is working.
Okay.
And more importantly, really, to see how we can improve it.
Okay.
And make absolutely sure that we're providing the best service for anyone that might use it within the doctor's surgeries.
Great.
So we're nearly all there with the information that I'm throwing at you at the moment. So I talked about confidentiality and everything being private that you talk about today. The only exception to that, Simon, is if you were to tell me that you had an intention to harm yourself in any way, or that you had thoughts of harming other people, then I would need to take that to another level. I would need to talk to someone else about that
Okay.
in order to find the right way to help you through that and keep you safe.
Right.
That doesn't mean we don't talk about it, because we've got plenty of time today, and we have plenty of time in our future appointments as well.
Okay.
So there is the opportunity to talk about that. So all I would ask really is just to be honest.
Okay.
As long as you feel comfortable and talking about things openly, then that's the way we get the best out of our appointments together.
Great.
All
Okay.
right?
Thank you. Yeah.
No, thank you for that. It's lovely. We've gone through all the agreements and things that we have to make, so it'd be good now if we can just talk about where you feel you are with everything at the moment.
Okay.
So it's just for you to really reflect on how your life is. The way we do this is with a well-being assessment.
Okay.
And I would say just don't labour over it too much. Have a think about what your first thought is.
Yeah.
So I'm going to just ask you about a few areas of your life, and if you could score yourself from 1 to 5, please.
Okay.
So 1 being the lowest it could be and 5 being the absolute best.
Okay.
And we do that because it gives us a starting point.
Yeah.
You can see where you are at the moment, and then we'll revisit this in 3 months' time.
Okay.
And hopefully some areas will have improved for you. And this will also help us form what action you're going to take going forward, how things are going to improve for you, and form a personalised plan for you to just take control of your well-being a little bit, really.
Okay. Sounds great.
Right, so so just the various areas that I'm going to ask you about.
Okay.
So first of all, how about looking after yourself? Where would you score yourself at the moment?
Probably about 2.
Okay, so, and how about managing symptoms?
Probably 2-ish again. I think
Yeah.
2. Yeah.
Okay, thank you. Work. So we've got in one section here, work, volunteering and any other activities.
1, I would say at the moment.
Yeah, so that's a bit of a low one for you now. And how about money?
1.
Yeah.
Yeah.
Okay, no problem. Where you live, we haven't talked about that really, but where would you score yourself? Is it, you happy?
Yeah. Probably about a 3.
Brilliant. Okay. Family and friends.
Yeah, probably 3.
Yeah,
Yeah.
thank you. Overall, your lifestyle. So really incorporating pretty much everything we've talked about.
Overall, probably a 2.
Yeah. Okay. And the last one to ask you is how about feeling positive? How positive are you feeling today?
Depends on the day, but today probably 3.
Yeah.
Yeah.
Okay. So that's a good start, isn't it? That's a good start. And we won't need to look at this again. It really is a baseline score so
Right.
that we know where you are
Yeah.
right now.
Okay.
Okay. Thank you very much. I know it's always awkward going through questions and scores and things. So
No, that's really great. Thanks very much.
thank you.
Thanks.
So now we've done the important bits of covering all the information that I needed to give you to begin with.
Yeah.
Can you go back to when Dr. White suggested we have a chat together
Yeah.
and just give me a bit of an idea of what his suggestion was for us having our appointments together?
Yeah, sure. So over the past few months, I've put on some weight. My blood pressure's sort of risen, and he thought it's not at a critical level yet, but he thought coming to have a chat with you rather than going immediately onto medication, which I'm happy with because I don't want to go onto medication for it just yet.
Okay. Great. So do you think that's what you'd like to focus on initially?
Yeah, I mean, initially there's other stuff going on around, so I was made redundant 6 months ago, which is where all this has really come from because I haven't had any interests or much going on. So I've been eating more at home and not really doing very much. And I've done a bit of applying for jobs, but nothing's really come back.
Okay. And it can be really demotivating, can't it? You've worked and everything's in a routine, and all of a sudden it's gone.
Yeah.
So it's understandable, isn't it? It's a bit of a challenge to remain motivated.
I think my priority really is my health at the moment.
Great. Okay, well thanks for pointing it out, because it might be that later on we can talk about other things. It might be employment or other stuff.
Okay.
So what really matters at the moment is to try and focus on perhaps reducing your blood pressure
Yeah.
through increasing some activity.
Yeah.
Okay, that's lovely. So do you get out and about a little bit? Do you go walking or?
Not really, no.
Not particularly?
No,
Okay.
nothing much.
And do you have company at home, or are you
No,
alone?
live alone.
You live
Yeah.
alone,
Yeah.
okay. Right, so let's have a think about what you might have liked to do in the past, if you've perhaps been more active in
Yeah.
previous years.
Yeah.
What sort of thing might you have liked to do?
So I used to really love swimming
Okay.
and cycling. Cycling was probably my main hobby years ago, mountain biking, but I haven't done that for years and don't know anyone that does it anymore, and
Okay.
don't have the fitness or a bike or anything for that at the moment. I wouldn't feel confident about doing that just yet.
So maybe something you'd need to build up slowly too.
Yeah.
Okay.
Yeah.
And you mentioned that you don't have a great deal of confidence at the moment for getting out and about.
Not for seeing like other people, and I feel quite self-conscious, and I don't really like to go out.
Okay. No, that's fair enough. No worries. So it would be good to perhaps work on that with you.
Yeah.
My initial thought is that perhaps to help you get back into cycling and gain that little bit of confidence and increase your fitness levels, perhaps we could start to have a look at the idea of a static exercise bike
Okay.
that you could use in the home. So
Okay.
you don't have to have any special cycling equipment or clothing or anything like that. You can do it at home, put your music on and enjoy it, so that you get a bit of a positive
Yeah.
experience.
I mean, it sounds great, but I'm on benefits, so it's a bit difficult for me to achieve that really.
Yeah, I can understand that, because I can imagine things are a bit stretched for you.
Yeah.
But we're very lucky that in the role I'm in, on the project I work on, we have a small pot of money. It's something called an enabling fund, which is exactly what it says. It enables people to get nearer their goals.
Okay.
So if we talk about perhaps your first intention to get an exercise bike that you can use at home
Yeah.
as the first step towards getting out and about in the fresh air and cycling, maybe meeting people, making friends,
Yeah.
then that would seem like a solution for me to use a little bit of that funding,
Okay.
which I should be able to do.
Right.
So if we have a think about getting you an exercise bike, I mentioned the enabling fund, which
Yeah.
I feel sure we can use. This is going to be instrumental, I think, in getting you back to a better fitness level.
Yeah.
So how do you feel about doing some research? Do you use the internet at all?
I do. Yeah, a lot.
Ah, well, brilliant.
Yeah.
Okay. So, and you've got a bit of time at the moment that
Yeah.
you could perhaps research
Sure.
the cost and the sort of things. I'm not saying that we go way up to the best
No.
we can
No.
find
No, of
anywhere,
course.
but something basic that's enough to get you moving
Okay.
a little bit more.
Yeah.
So if you can do that, we'll put together a little action plan of what
Okay.
you're going to do,
Yeah.
what I'm going to do, and how we bring it all together then.
Okay.
So I think I mentioned that we'd have a meeting together again in 6 weeks' time,
Yeah.
but we definitely don't want to leave it that amount of time.
No. No.
So if we say you have a look over the next week on
Okay.
the internet,
Yeah.
make some notes, or save what you can find,
Sure.
we can arrange that I'll give you a call in a week's time.
Okay.
So it's Wednesday today. Next Wednesday I can give you a call.
Okay.
Is it better for you, morning or afternoon?
Mornings would be good.
Mornings
Yeah.
good.
Yeah.
Okay. So if you can have ready what you've found, then
Sure.
give me an idea of what the sort of cost might be.
Okay.
Then we can agree.
Okay.
Those kind of things I think can usually be delivered quite quickly, so
Yeah.
we can get you started
Okay,
on that,
great.
which I think would be a real positive mood for you.
Yeah.
So actually I've got off quite light there. I don't actually have to do anything because you're doing all the work. But I think it's a good thing because
Yeah.
you're finding what you need there.
Yeah.
And you know, the bits and pieces that I'll do with you will come later for
Okay.
sure.
Okay.
So I think that's what we need to do.
Okay.
Ask you to have a look on the internet.
Yeah.
I will call you again next Wednesday
Yeah.
and just catch up with you about what you found.
Okay.
Before you leave, we'll make an appointment for 6 weeks' time,
Okay.
and just to check which number I should call you on. You've got landline and mobile.
Mobile's best. Yeah.
Okay, brilliant. Thanks, Simon. We've got quite a lot of information today, and we've got a little plan going forward. So before we finish up, is there anything else you want to bring up or chat about before we end today?
Not today. No. I think that's it for
Okay.
today.
Brilliant. If there is anything that comes to mind in the next week, just make a note of it when we catch up on the phone, and I look forward to speaking to you then.
Great. Thanks very much, Jackie.
Thank you.
Cheers.
Thanks.
Okay, so there we have it. So in addition to that initial session with the social prescribing link worker, the importance here is to maintain the follow-up, to support that patient through their journey and to ensure that they are motivated and reassured and help to keep on track really and supported. So therefore the follow-up telephone calls or one-to-one appointments are of paramount importance.